it's interesting. It's a little disturbing maybe, but it's interesting that we are literally swimming around in a soup of a microbiome soup, and what we are struggling with as clinicians and researchers and people who are interested in this is how do we make this change, the sea change, and this paradigm shift from this idea that the gut should be studied in isolation to instead where maybe it should be studied in relationship with the rest of the organs. And the same thing in terms of our ecological sense of who we are and how our gut functions. So the brain is quite dependent on the gut. Quite dependent on the gut for the absorption of the nutrients that it needs to do its normal functions, okay? Malabsorption syndromes and other kinds of gut disturbances that result in nutritional deficiencies, it'll affect the gut. The gut's also, when it's not healthy, is a source of inflammatory cytokines. These things, the cytokines can travel broadly and increase inflammation in the brain. And the gut is, for people who have chronic gut disorders, it's a source of psychological and physical distress. Likewise, ask about relevant gut history and stressors in their past, okay? Extensive foreign travel, history of parasites, frequent antibiotics, inflammatory bowel disease like Crohn's disease and ulcerative colitis, and IBS, terrible diagnosis, IBS. C. difficile, a terrible stressor on guts. Many people who had C. difficile, their guts are still not right, either because of the damage from C. diff, the dysbiosis that follows because they're on antibiotics, and frequent antibiotics for any other reasons, or a history of food allergies. Feel comfortable with referring to a gastroenterologist. You might put your toe, right, in the kiddie end of the pool here and order a poop test on somebody and find something that's a little distressing, okay? Don't be shy about just saying, you know what, I think this is outside my wheelhouse. This looks more serious than I think I can handle, okay? Then we have a faculty and we all have emails, and so if you find something like that on a poop test and you're concerned about it, then give us a call or send us an email. We can help you understand whether or not what you have found, right, is not appropriate to be treating in your office and needs the attention of a gastroenterologist. But don't go down the path with patients who have uncontrolled gastrointestinal chronic disease. So on stool testing, the most common way that we see this is with human pancreatic elastin as a marker for the production of pancreatic enzymes, okay? Not a foolproof test, but very useful. Chymotrypsin is still used in some comprehensive stool testing, and then we see other forms of maldigestion in the form of protein, okay? This is also somewhat reliable, but it's helpful when it's elevated because then you know the proteins aren't getting digested, and that gives you a hint as to what the patient would need. This is the 5R treatment protocol thing, and this is super helpful in staying oriented if you're ordering comprehensive stool testing, okay? And why is that? Because the gut's complicated. However, you can keep your feet underneath you if you remember, remove the bad guys, okay? All right? Replace the things that are missing. And we're talking about digestive acids, pancreatic enzymes, bile acids and such. Re-inoculate with prebiotics and probiotics. Give repair support, okay? And rebalance. Make sure the patient is doing their self-care, because if they eat at Taco Bell and drink a 6-pack of beer, they're going to undo your work.